My name is Immaculate Kamau from the University of Nairobi, Kenya, doing a master's degree in public health. I am a beneficiary of Student for Development program, which is funded by CEDA, doing an exchange program for 1 term at the University of Manitoba, and it has been an exciting winter for me.
My name is Carol Olela from University of Nairobi, Kenya, beneficiary of the SFD program, and I'm at the University of Manitoba currently doing an exchange program at the Community Health Science, and it's been for the past 4 months. Yesterday we went to one of the shelters in Manitoba for the women who are having various challenges, that is domestic violence and probably dealing with drug issues. And we just went there to share their experience and probably share our experience back at home in Kenya and just see how we are like in certain areas and the differences that we have in the various areas that we come from.
We met 2 caretakers. At the time there were only 5 women who were being taken care of there, and 2 of them who are expectant and suffering domestic violence, and 3 of them who are recovering from drugs.
We did quite a lot of things. We shared a meal. They made for us their traditional food, and we also carried some Ethiopian food. It's not necessarily from Kenya, but it's from Africa. So we were able to share what we took to them, and we also took for them some feminine products as well as child products, because some of the women have got children, some are expectant, so they need to use some of these things and they're not able to afford. So we just thought it was wise for us to at least carry something along and just share.
These women, most of them just leave their homes abruptly to come to the shelter, so they basically carry nothing, and they need all the essentials that a woman needs for every day, and all they have is the clothes that they come wearing that day. So they are basically at the mercy of the people of goodwill who visit the shelter and who can be able to donate those items for them.
They asked if we also have similar shelters back at home, which we actually don't have, and they've also asked if a lot of women there go through drug issues like they go through here, but fortunately or unfortunately, most of them don't go through a lot of drug issues, but they go through domestic violence and a lot of challenges back at home.
There are a lot of lessons that I learned, and it was such a valuable visit for me. Above all, the thing that I learned is that women only need to be empowered, and they develop the wings by themselves, and they're able to take off and fly again.
The most rewarding part, or rather experience, is the way they talk about their challenges openly. It's not very easy for women in our community to talk about their challenges easily, because they fear being labeled and just being outcasts in the community. So it's really a nice thing for just a woman to come and share with you. It's like it helps them to get off the load that they've been having, which is not very easy for a lot of women to do.
The program under which I came is funded by CEDA. There is an exchange program between the University of Nairobi and the University of Manitoba.
It is important to me because it has given me an opportunity to just come and share what's happening in the developed world and compare what we can, carry from here and take it back home and see if it can work for the people back at home, that is in the developing country, and to be specific, Kenya.
In Kenya, women go through a lot of challenges, and if there was to be such a shelter in Kenya, a lot of women would benefit. Women go through all sorts of abuses, such as rape, female genital mutilation. Some of the women are detained in health facilities for failure to pay maternal and child health services fee, and such shelters would be very helpful to such women if they are to be rolled out in our country. And it is my hope that we can be able to see that in the near future.